My name is Mike Jackling and I work for Pro Benefits of Washington. We are part of the Capital Benefits Group. We're located in Bellevue, Washington and serve Washington and Oregon states. As a licensed insurance agent, my role is to assist individuals navigating Medicare and the related matters. My goal is to make this transition easier and to be a trusted resource. Today I'll provide a high-level overview of Medicare and related topics. Common questions we'll cover today. What to expect as you approach Medicare eligibility? What are original Medicare benefits, Part A and B? What is a Medicare supplement, also called a Medigap? Does Medicare cover dental, hearing, or vision care? What is a Medicare Part C, also known as a Medicare Advantage plan? And what is Medicare Part D, prescription drug coverage? Next steps and available resources. Entitlement to Medicare may be triggered by several circumstances, including turning 65, which benefits may begin as early as the first day of the month you turn 65. 24 months after receiving Social Security disability. Loss of employer group coverage if you had delayed. Enrolling in Medicare can be completed a few ways. Directly through the Social Security office, applying online at www.ssa.gov, that's the Social Security Administration website, or by calling 1-800-772-1213. I don't advise this as wait times can be long. If you continue to work and have employer group coverage, you may want to delay your Part B coverage until you retire or lose coverage, whichever comes first. Please note, group size may impact considerations. If you're working for a small group employer, you may want to check with your employer, insurance company, or Social Security Administration for additional considerations. Technically, you will have 8 months after you losing your employer health coverage to enroll in Part B without penalty. COBRA does not qualify as creditable coverage to avoid a penalty. Your money. Let's take a look at how the money flows. When you enroll in Medicare A and B, you will be billed for the Part B premium. CMS under the U.S. Department of Health and Human Services then pushes funds either toward original Medicare A and B or a Medicare Advantage Part C plan, which is a private insurance plan extending Medicare benefits. Most people secure their Medicare coverage in one of two ways. First, one enrolls in Medicare A and B, that's original Medicare, and adds a Medigap or supplement plan as well as a Part D plan. This method may entail 3 cards and 3 billings. Medicare drives what is covered. Medicare supplements, also called Medigap plans, are standardized and designed by the federal government. They are administered by a private insurance company. Medigap plans are identified by letters ranging A through N. They provide coverage for some health care costs that original Medicare alone does not cover, such as copays, coinsurances, and deductibles. Medigap plans pay secondary to Medicare on a Medicare-approved expense. If Medicare does not cover something, the Medigap plan will not cover it. Medicare must cover a service for the supplement to cover it. You must be enrolled in a Medicare Part A and B before you can enroll in a Medigap plan. Medigap plans do not include prescription drugs. If you'd like drug coverage, you can purchase a standalone Part D plan. Medigap plans are not tied to a provider network such as a PPO or HMO. A participant may use any provider that accepts Medicare. Some Medigap plans also have a foreign travel emergency benefit. If you purchase a Medigap plan, you pay a monthly premium. Many Medigap plans have lower out-of-pockets than other Medicare options. However, the premium usually costs more than a Medicare Advantage plan. The second option would be a Medicare Advantage plan or Part C plan. They are health plan options approved by Medicare and run by a private insurance company, which provides your coverage. When you choose to enroll into a Medicare Advantage plan, you choose to have a private health insurance carrier administer Medicare for the federal government. They provide your Part A hospital insurance and Part B medical insurance benefits and cover all the medically necessary services that original Medicare provides. They may extend some extras under a Medicare Advantage, such as dental, vision, or alternative care. Medicare Advantage plans with prescription drug coverage usually have a lower monthly premium in comparison to enrolling in a Medicare A and B with a Medicare supplement and an additional Part D drug plan. Original Medicare is comprised of having both Medicare Part A and Part B. Part A is hospital insurance. Part A covers things such as inpatient hospitalization, skilled nursing, hospice, and home health care. What does Part A cost? You usually don't incur a monthly premium for Part A coverage as long as you've paid Medicare taxes while working for at least 10 years or 40 qualifying quarters. Medicare Part B is medical insurance, and it covers things such as doctor services, outpatient hospital services, certain home health care services, durable medical equipment, injected or infused therapeutic drugs, and certain medical and health services not covered by Medicare Part A. What does Part B cost? $202.90 is the monthly standard Medicare Part B premium in 2026. This gets adjusted each year. It is generally deducted from one's Social Security check. However, if one is not collecting Social Security, Medicare will bill for these premiums. The monthly Part B premium varies for higher income earners. It is worth noting Part B has a $283 calendar year deductible before Medicare pays 80% for most Part B services, leaving the Medicare beneficiary the responsibility of the 20%. There's no maximum out-of-pocket limits in relation to Part B. Your Medicare cost sharing and IRMAA, income related monthly adjustment amount considerations. For 2026, this chart displays the Part B premium and IRMA considerations combined. Medicare will utilize one's tax filing status and modified adjusted gross income from 2024 for 2026 considerations. This will be adjusted each year. In 2027, they will look at one's 2025 modified adjusted gross income. Let's consider two examples from the table. An individual tax filer who made $109,000 or below in 2024, their Part B shows to be $202.90 per month. A couple who made between $274,000 and $342,000 will have a $202.90 Part B premium plus an IRMA charge of $202.90 for a total monthly cost of $405.80 per month. Again, this premium is for each. If you are billed IRMA in relation to Part B costs, you will have another IRMA charge for Part D coverage if you secure Part D coverage. We will address this later. Let's take a look at how a Medicare supplement plan works. When you receive medical services, you give your provider your Medicare card and your Medicare supplement or Medigap insurance card. Medicare in turn will pay its responsibility, and the Medigap will pay the balance based on your plan. There are many Medigap options to select from. Plan G is the best available to someone turning 65 today. This chart assumes Plan G. Medicare supplement plans. A Medicare supplement policy is a health insurance plan sold by private companies to fill in the gaps in original Medicare costs incurred. These plans are also referenced as Medigap or bridge plans. Medicare supplement plans offer the same benefits as original Medicare and do not have added plan benefits above what original Medicare offers. You must have Part A and B and continue to pay the Part B premium. All Medigap policies are standardized plans. A through N. The benefits included in the plan you choose are the same no matter which insurance company provides it to you. For example, a Medigap Plan G with each carrier is exactly the same, though the premium or service level may vary from carrier to carrier. Medicare supplement plans continued. Medicare is the primary insurance and they determine whether something's covered. The supplement plan simply follows Medicare's lead in how to process the claim. Medicare supplement plans do not use insurance company networks. Since Medicare is the primary insurance, the provider must accept original Medicare. Some providers may accept Medicare but not assignment. These providers may be considered non-participating, which allow them to charge an extra 15%. This must be disclosed by the provider. You're not required to list a primary care physician and referrals are not required. Plans automatically renew each year. The benefits rarely change. The only thing that can change on an annual basis is the monthly premium. Medicare covered services are services that Medicare deems medically necessary. Some things that Medicare doesn't consider medically necessary are cosmetic services, investigative or experimental services, alternative care, which includes chiropractor, acupuncture, naturopath, and massage therapy, and routine dental, vision, and hearing services. This chart shows the Medigap supplement plan options A through N. Please note, C and F are no longer available. One must have turned 65 prior to 2020. G and N are considered the top options. Some companies also offer a Plan G with a high deductible. Part D, prescription drug plans. Part D plans are available to anyone who is enrolled in Medicare, Part A, Part B, or Parts A and B. A Medicare Part D prescription drug plan is optional, but you may be subject to a late enrollment penalty fee if you do not enroll in one when first eligible. Part D plans provided by private insurance companies. The monthly premium varies by plan, and you're only allowed to have one Part D plan at a time. Medicare Part D IRMA, IRMAA. Like the Part B IRMA, one may be subject to a Part D IRMA. The easiest way to describe this, if one triggers IRMA in regard to Part B premiums, and they're enrolling in a Part D plan, they will have an IRMA charge. Medicare Prescription Payment Plan. New as of January 1st, 2025, the program may allow one to spread their prescription payments out over the course of the remainder of the year. It is available to anyone with a prescription Part D plan. If one is interested in the program, they would contact the Part D plan to enroll or get information. Medicare Part D. How does it work? First, the deductible level. One may have to pay 100% of the drug costs until the deductible is met. Typically, those deductibles range from $0 to $615 in 2026. Some drugs may be covered for copays at this level. Second, the initial coverage. One may have to pay copays or co-insurances for covered drugs, while the Part D plan pays the rest. Catastrophic. Once one has out-of-pocket costs for covered RX or covered drugs of $2,100, the plan will pick up costs moving forward. The numbers may vary because of how the true out-of-pocket is calculated. Medicare Advantage, Medicare Part C. A Medicare Advantage plan is a private individual medical plan. Often provides several additional benefits not available with original Medicare. Does not replace original Medicare. It pays your medical expenses instead of Medicare. Eligibility. You must have Medicare Parts A and B, and you must live in the service area of the plan you want to join. Medicare Advantage. How it works. When you enroll in a Medicare Advantage plan, your Medicare Advantage card replaces your original Medicare card. Medicare prepays the Medicare Advantage plan insurance company. The Advantage plan insurance company then works with the doctor, hospital, or insurance provider to manage or administer your health care. Types of Medicare Advantage plans. First, HMO, Health Maintenance Organization. You must use a primary care physician, PCP. You must stay within the network or services will not be covered. Exceptions to this may be emergency circumstances. Network of providers may change during the year. Second, PPO, Preferred Provider Organization. Access in network of care from a list of providers. Again, that network may change during the year. It allows one to visit any doctor or service provider who accepts Medicare. If you're using out-of-network providers, they're not required to accept the insurance, and you will often experience higher cost share than if you used an in-network provider. Access any doctor or service provider in the network without a referral, but please note, some provider groups may require a referral. Third, HMO POS, point of service. Use networks. Network of providers may change during the year. You have to have a primary care physician, medically appropriate referrals. And fourth, special needs plans. Qualifying chronic illnesses, Medicaid benefits, or institutional patients. Advantage plan structures. A Medicare Advantage plan has a benefit structure much like an employer group plan or individual medical plan offering that most of us are used to prior to enrolling in Medicare. Rather than separating benefits into two service categories, think of Part A hospital, B medical, the benefit structure of a Medicare Advantage plan lists specific services and the associated cost share. A cost share will either be a copay or coinsurance that you will notice. Medicare Part C, Medicare Advantage. Let's look at some of the considerations when selecting a Medicare Advantage plan. Of course, there's the monthly premium, the annual maximum out-of-pocket, MOOP, inpatient hospital copays, physician visit copays, skilled nursing costs, ambulance costs, emergency room costs, diagnostic testing, that could be lab work, imaging, x-rays, outpatient services such as day surgery or administering Part B drugs, plus additional embedded or optional benefits may be included in the Medicare Advantage plan, but not always. Prescription drug plan, fitness programs, vision plan, dental plans, hearing, transportation, even meals. Medicare enrollment periods. First is the initial enrollment period, IEP. This begins 3 full months prior to one's 65th birthday month, runs through the 65th birthday month, and 3 full months following. If someone has a birthday on the first of a month, there are some extenuating considerations. Annual election period, AEP. This runs October 15th through December 7th each year for a January 1 effective date. Medicare Advantage Open Enrollment Period, OEP. This is available January 1st to March 31st each year and allows one to switch Medicare Advantage plans, or you can change from a Medicare Advantage plan back to original Medicare and select a Part D RX plan. Special Enrollment Period, SEP. This may occur at different times of the year. Examples may include moving to a new service area or losing employer group coverage. If you join a Medicare Advantage plan and it does not meet your needs, you have a one-time opportunity to change back to a Medigap plan within the first 12 months of that first enrollment into a Medicare Advantage plan. And last, the 5-star rating SEP. Medicare Advantage Plan 5-star quality rating system. Plans can be rated between 1 and 5 stars. Medicare establishes ratings for Medicare Advantage and prescription drug plans using multiple factors from primarily 5 areas of consideration. Staying healthy via preventive services, screenings, etc. Managing chronic conditions. Ratings of plan responsiveness and care. Complaints, appeals, and voluntary disenrollment. Telephone customer service. A 5-star rating is considered excellent. These ratings help you compare plans based on quality and performance. So, how do I decide? How much can I afford? Do I travel frequently? Will my doctor or hospital accept the plan? Are my prescriptions covered? Do I need referrals to see my specialists? How often do I use my medical services? Do I have any upcoming medical procedures and expenses? Some financial assistance programs. There's the Medicare Savings Program, Medicaid, Low Income Subsidy, just extra help, and the prescription discount cards available. If you think you might be eligible for assistance, apply. Medicare Savings Program, Medicaid of Washington, you can access online at www.washington.gov. CONNECTION.org. That's the WashingtonConnection.org. You can also apply at a local community service office. And lastly, 1-800-562-3022, extension 16129. In Oregon, you can apply online at www.one.oregon.gov. And that is www.one spelled out, period, Oregon spelled out.gov. You can also call 855-673-2372. Low-income subsidy or extra help to lower or cut your Part D drug costs. You can access that online at www.ssa.gov/Medicare/prescription help/. Or you can also engage a local Social Security office. And finally, 1-800-772-1213. Prescription drug discount cards. Sometimes there's value in considering these programs. Who offers them? How can you learn more? GoodRx can be found at www.goodrx.com. Single Care RX details can be found at www.singlecare.com. And finally, RX Cut details can be found at rxcut.com. I hope you found this information of value. I am always available for more individualized conversations. Please feel free to call or email me, and I'll do my best to assist you. My phone number is 425-526-3469, and my email is mike@probenefitswa.com. That would be MIKE at PROBENEFITSWA.com. Thank you for taking time to listen to this Medicare 101.